Welcome to the podcast of the Center of Translational Medicine. Today my guest is Marie Engh, a medical doctor and also a student of the Center of Translational Medicine, but not only a student but also an SMS. What does this acronym mean?
So the acronym actually means Scientific Methodology Supervisor. At this point, I'm no longer considered a supervisor, I'm considered an advisor. So I'm actually one of the SMAs.
Another acronym.
Yeah, another acronym. We have a lot of those. SMA, SMP, SML. But basically, we are the methodological guidance for the younger students. In my case, I help the second-year Ph.D. students with their projects.
So you are involved in several projects, am I right?
Yes, exactly. So I have about 18 students. Each of these have at least two projects. And of course, I have my own projects. I have my co-students' projects. I recently counted the number of projects I have currently ongoing, and it's 22 projects.
Oh, incredible. So this is quite challenging, I think, even for very experienced researchers to cope with so many different projects. But how can you cope with this challenge to work parallelly on several projects?
Well, luckily, I'm not the main person in charge of any of these projects. And I have developed a little bit of a routine now where every time we have a meeting, I do have the students summarize the project. So, I get reminded. Of course, at this point, there are so many projects, you really have to have notes somewhere. You have to keep proper track because there's no way to mentally stay involved in each project. That was a lot nicer as an SMS when I only had 9 students, because I really did feel like every project was mine and I knew exactly what was going on at any given moment.
But you have to be very good at time management, and you have to be also a good project manager.
Yeah.
And
yes.
How did you learn these skills? Because these do not belong to normal medical education.
And this was really a case of learning by doing. So, starting as an SMS, it was a very rapid change. I started with 5 students at first, and then very quickly I got another 4 students, so I had 9 students in total. And the very first weeks were challenging, trying to figure out how to stay on top of each project, where to keep my notes, how to stay organized. But because I could start with 9 students, I could carry that over when I then had 18 students as well. So it wasn't easy to begin with, but it's really the kind of thing you learn by doing. I don't think anyone can just teach you that.
Just to go back to the beginning, how did you get into the CTM? How did you choose to join CTM? Because you are one of the first students of this center.
Well, yes, I've been... my story with the CTM is a very long one, because I was a medical student in Page. And back in 2017, I was actually at a TDK Burge, and I walked past the stand where Balint Erush was standing back then, and he was showing some project he had ongoing, and I decided to join his project. And that's also when I started getting into meta-analyses. I started going to the meta-analyses workshops, back then held in Budapest as well. And around the time that Peter Hedje and his team were planning to move to Budapest, I was also approaching my graduation, and I was trying to decide what to do. And somehow the idea got floated that I could join as a PhD student. And that very quickly became a real possibility for me. And because of the move to Semmelweis, I also thought, okay, Budapest is a nice place. I can imagine living there. So I came along. So this is now 6 years in the making.
Okay. Nice story. And as a PhD student, could you continue the work you started as a student?
Yes.
Or is it a different one?
I mean, I had an ongoing meta-analysis back then, but I very quickly realized that the projects I started in my first year were a lot better. So I decided to focus all my energy on those instead of resubmitting the first one. But I'm still in the kind of same field, so I'm still doing gastroenterology, and of course I'm carrying along the experience I have from the previous metas that I did, because as a TDK student I was also a co-author in 2 network meta-analyses and 2 that remained unpublished regular meta-analyses. So carrying over that kind of methodological knowledge really helped me in my PhD.
And what is the main focus of your PhD?
So my PhD focuses on endoscopic ultrasound-guided tissue acquisition from solid pancreatic masses. I'm looking at the different techniques and equipment that you can use during the sampling procedure in order to achieve a higher diagnostic adequacy rate from the samples.
And currently, are you able to work only also as a medical doctor, as a practicing medical doctor?
I'm currently not practicing medicine because as a foreigner in Hungary, my Hungarian knowledge really is not there yet, unfortunately.
But also the time you need for science.
I mean, I have one scientific day. Actually, today is my science day, so right now I'm working on my own project. But also just all the work that I do for the Center of Translational Medicine, it's a full-time job, actually. Yeah. So I'm okay with that because I enjoy the methodology a lot more than I do clinical work, I think. But even if I wanted to, I don't think I would be able to do medical work right now.
When you started the university, what was your vision? Did you want to become a doctor who is treating patients, or did you want to become a scientist, or what was the main goal?
To be honest, I probably decided to study medicine so that I wouldn't have to make up my mind about that. Because I come from a family where on the one side of my family, everyone's a doctor, and on the other side, everyone is a scientist. So everyone has a PhD and is doing research.
So you saw both sides.
Yeah, I thought, I'm just going to start medical school, and then at the end, I'll decide if I'll go for the research pathway or the medical doctor pathway. And to be honest, I still haven't decided because I kind of like both.
Yeah, but you have the freedom to go both ways. But do you think, is there any advantage for a medical doctor if he or she does also science?
Absolutely. I think understanding the literature would help anyone be a better clinical doctor. Because first of all, understanding the guidelines, understanding the base of the guidelines, understanding why some recommendations are weak, why some recommendations are strong, and understanding when a treatment that you believe to be effective is not. I think those are really important things for a clinical doctor. So I think that there are still pitfalls in clinical medicine where doctors become so convinced by what they see over what the actual numbers show that they still make decisions that are not necessarily the best for the patient. So I think a basic understanding of research and what the science shows is very important.
So it's about attitude, or not?
Maybe. Of course, since I'm not clinically active, I don't want to be that person that comes in as a arrogant scientist saying, "Oh, you're doing it wrong." But I think that medicine is such a research-based field, actually, that understanding the research is key for practicing it at your best.
And what are the skills that are improved during the education in CTM that can make you and all the other students a better doctor?
Actually, the thing that I appreciate the most about the system that we have here is the fact that everyone starts with a meta-analysis, because during a systematic review and meta-analysis, you have to read so many clinical papers, and you have to really dissect them. So you have to first understand what the outcomes mean. You have to understand the risk of bias. You have to grade the evidence. So you really learn to critically assess the literature. And I think once you've done this enough, later on, when you do read the newest research coming out, you'll be able to understand, okay, is this paper believable? Is this paper well done? Could there be any big pitfalls in this paper? Or can I actually read this paper and apply it to my patients immediately? So I think that's one of the very key skills that we learn here.
And what are the parts of the education that you don't like, or are there any which were very hard for you, or were struggling?
Well, to be honest, for me, nothing has been really that hard here. I mean, my experience at the Center for Translational Medicine was, of course, a little different from the others because the courses I participated in more as a teacher than as a student. I think that in general, the amount of time that is needed and the amount of focus in order to be able to finish your projects can be overwhelming, but it's nothing that can't be handled in some way.
Yeah, and is there a secret how you manage your time?
To be honest, I just spend a lot of time on my. I mean, I would not consider myself a very skilled time management person. Because this is my number one priority, I'm okay spending weekends and evenings and odd hours of the day on my projects or on the work.
What about your private life? Do you have any private life, any hobbies, or are you full-time scientist and doctor?
Well, I do have some hobbies. So I play a few instruments. I don't practice as much as I would like, but I do play them.
What kind of instruments?
I play the violin and the piano.
Oh.
And I have both here, so I do play.
You are lucky.
I am quite lucky. I don't play as much as I would like, but I do have some time. I mean, some ways to spend my time, but I'm lucky enough as well that my colleagues are my friends. And this is what I enjoy doing. So I can happily spend the majority of my time on the research part and on Center for Translational Medicine things.
Okay. Thank you for accepting our invitation and be the guest of the podcast of the Center for Translational Medicine. And thank you for your patience and for your time also for those who are listening or watching us. Thank you.
Thanks for having me.
Thank you.